So we have two more presentations now before the end of the day. The first one is an interview with Dr. Mani Mashako. Dr. Mani Mashako from DRC, who is a pediatrician from DRC with experience of over 20 years in DRC, in the Yemen, in Niger, Mali, West Darfur, and who has worked with MSF since 2019. And he's a strong believer in ongoing medical education to save lives. So this is very fitting to our topic here. Welcome, Mani.
Leur projet. Aujourd'hui, nous avons la chance.
We are going to try and answer this question today. Thanks to Dr. Mani, who is with us today. He's going to talk about his experience. So, hello, Dr. Mani. Hello. I'm very pleased to be with you today. My name is Mani Mashako. I'm a pediatrician. I've been working for the past 20 years approximately in pediatrics. I joined NMSF in 2019. For now, I'm a pediatrician on the El Janina project in North Sudan. Oh, well, we're very lucky to have you with us today. So, which pediatric days did you take part in? Well, the latest edition, the one in 2021, that was online, was the first online event, and I took part in all sessions. So last year, we discussed several issues, including tuberculosis, COVID. I assume you've worked in various contexts. So maybe you could explain to us how this is being useful in your daily work, how the sessions have proven useful. Well, indeed, various topics were tackled. For example, we heard about neonatology, back to the basics, to the fundamentals. They insisted also on breastfeeding. And really, this drew my attention because in Niger in 2021, on the ground, we were faced with a challenge, the increase in the number of children with a low weight, insufficient weight. And we had to really find a solution to this. And we based our work on the findings of the latest edition of the Pediatric Days. We set up an intra-hospital study in order to try and understand the root causes for this underweight. And we understood it was due to poor breastfeeding practices that had led to those insufficient weights. And this is how we worked in order to find a solution to that problem. Okay, very well. So, and did you have any challenges when you tried to implement a solution? Well, yes, indeed. First, we had to understand why we were faced with those low-weight children, and we did this intra-hospital study, and this really revealed that this was due to poor breastfeeding practices within the community. And within the hospital, we launched the double suction technique, and also we corrected those poor breastfeeding practices. We sensitized, we raised awareness amongst the community, amongst mothers and next of kin, and this is how we improved the situation. Well, thank you. This is indeed a very important aspect about community engagement. This is another topic that was talked about during the latest edition. Do you have any other examples of activities carried out within the community? Do you have any experience based on your participation in the Pediatric Days? Has this helped you lead to the adoption of new approaches? Well, yes, indeed. For example, community care models that can be adapted to the various needs of children. And we had COVID, obviously, which impacted various programs and the care given to children. Indeed, we were faced with an issue, a nutritional issue, and because of COVID, the program was impacted, and we launched an early screening strategy in children in order to detect malnutrition in children within the community based on the mama contribution. So we trained mummies in order to detect malnutrition early within the community using the observation of nutritional edemas, for example. And I'm sure that this will lead to long-term benefits. Well, thank you. This is a very interesting example indeed. I'm very pleased that we have had the possibility to talk about this during the last edition, and that this is being beneficial in your daily practice. But any advice, any piece of advice for future editions of the Pediatric Days? Well, MSF is an organization that provides answers to vulnerable populations, and those are evidence-based solutions. And in my view, those pieces of evidence are being discussed and presented during the Pediatric Days. It's a good time to improve our daily practices on the ground. This is why we would suggest that this activity is then adopted by the various medical groups and doctors, so that the people who take part in the Pediatric Days can then implement the right strategies in the field. Wow, thank you. This is indeed really interesting. I believe there's some work to do. So what can be done after the Pediatric Days, and how can we include all we've learned during those days into our work on a daily basis? This is a key aspect. There's also a key point about the Pediatric Days also to listen to colleagues, to hear about projects as you did today. So thank you so much for having shared your experience with us. And I wish you a very good rest of the Pediatric Days. And thank you very much to you. Thank you so much, Dr. Mani. Thank you.